Okay, so we're going to move on to our second speaker for this afternoon, Mrs. Dr. Sharon Lambert. Sharon is based in the School of Applied Psychology in UCC, and she has many different roles and hats, so you often come across Sharon in different capacities. I know Sharon particularly because she is a member of our advisory group for the Silent Voices initiative within Alcohol Action Ireland, but she herself has worked in many different areas, both in community-based settings that where she'd be providing support for marginalised group, and she has many research interests. Specifically here, I think she's wanting to talk about the impact of trauma on development. So at this point, I'm going to hand over to Sharon, and Sharon is also going to lead our panel discussion, which is coming up just after her presentation. Thanks very much, Sharon.
Thanks very much, Sheila. I was hoping there would have been a Q&A because I needed to catch my breath after that last presentation from Elizabeth and David. It was, as you know, I'm well aware of Operation Encompass, and I'm a big fan of it. And I think that was the most compelling presentation I've ever heard on why we need to get Operation Encompass in Ireland. So anyway, I am going to catch my breath and I'm going to do my presentation. So I have slides, but they are mostly to remind me of what I wanted to talk about because I get very distracted and I have so many things I want to say. I need to try and keep focused. I suppose one of the things when we're talking, so I'm just going to, these are my thoughts about why we need to have trauma-informed education. So prior to working in UCC, I worked with young people in the community who were experiencing a lot of challenges. And one of the things that I had noticed was, you know, the increase in the numbers of young people that were coming through the door where they had lots of different clinical diagnoses, like oppositional defiant disorder, conduct disorder, etc. One of the things that I never saw was a child diagnosed with a trauma disorder, despite the fact that they had quite significant experiences of trauma. I think one of the things that, you know, we need to start thinking about is in terms of how we have medically approached human suffering and how children are carrying around burdens of disorders like conduct disorder, oppositional defiant disorder. Those types of labels actually exclude young people from services. And when we think about a child, for example, that might be diagnosed with conduct disorder, we don't think about their story and what it is, you know, that may have led to that diagnosis. And that diagnosis just does not capture their story. So one of the things in relation to children, and all the speakers have spoken about this, is about, you know, during the school day, how are you supposed to have time to do everything that needs to be done? But childhood is a critical period in terms of the development of mental health issues. A very big study here by Kessler et al. Showed that, you know, 50% of all lifetime mental health issues have started by the time you're 14 years of age, and 75% have started by the time you're 18. And you know, Kim spoke about this. You cannot learn if you are stressed. You cannot learn if you're experiencing emotional distress. So my question is not how do we fit this into the programs? It's why do we not do it? Because how can we teach if people cannot learn? So in terms of thinking about the kind of issues that children are bringing to schools when they turn up in the morning, here are some headlines from newspapers in Ireland in the last 7 or 8 months. 2 children a day are becoming homeless in Ireland. Children experiencing homelessness, that is a traumatic experience. I've done a lot of research in homelessness with families experiencing homelessness. There are children who are homeless who are coming to school, and the school do not know that those children are homeless because parents and children are keeping it a secret because they're embarrassed and they're ashamed. It's estimated that 200,000 children in Ireland are living with a parent with problem drinking. And the chaos and the worry and the concern that brings. So for those children, when they arrive to school in the morning, are they ready and able to learn? Are they willing? Are we willing to start to think about all of the children that come through our door? You know, we've had a very powerful contribution there from David and Elizabeth in relation to alcohol and its role in domestic abuse. We know that there was an explosion of domestic abuse calls during COVID. But outside of that, it is estimated that 1 in 4 women in Ireland have experienced intimate partner violence, and children who are in those homes are not witnesses. You do not witness domestic abuse. You experience it. You experience it as a physical and emotional threat. Poverty is a trauma. More than 25% of people who are living in poverty in Ireland are children. And ethnic minority children, especially traveller children, are not managing to get through the education system. And it's not their fault. They are children. It's because we haven't designed a system that holds them. And the children say that they do not feel wanted there. And they say that they get called names, and that when they do, that is not dealt with appropriately. So when children are coming into school, they may have experienced an individual trauma, they may experience a group trauma, or they may experience a trauma as a community. So for example, the traveling community and their experiences of discrimination and racism. They may have experienced single incident trauma, complex trauma, so things like domestic abuse, developmental trauma, those adverse childhood experiences, that particularly the first 1,000 days, intergenerational trauma, so they might be living with a caregiver who's experienced a very difficult time themselves, and perhaps in order to manage that, they might be using drugs or alcohol to cope with their emotional distress. You were impacted by historical trauma. We're facing future traumas, and this has already been mentioned in relation to the climate crisis. And the experience of immigrants, refugees, marginalised groups, and ethnic minorities. So, we have already spoken a little bit about the ACEs study, which was the 10-item scale that was used by Felici et al. In the United States. The issue with the original ACEs scale is that it places all of the adversity within the family home. And while lots of adversity does happen in the family home, it's better to take a biopsychosocial approach to understanding human beings. So if we're experiencing psychological distress, it rarely happens without some kind of context. So social policies, for example, impact on the kinds of adversities that happen in family homes. So if you take housing, for example, if housing policies are not good and children are living in homelessness, that increases the risk that a caregiver may have depression, or may use drugs and alcohol to cope with their situation. So, being mindful that when children experience adverse childhood experiences, it's not just the things that happen in the home. It's also things like bullying, poverty, peer rejection, experiences of racism, death, multiple and traumatic loss, exposure to community violence, food scarcity, experience of the care system, poor academic performance, and then living in an unsafe environment. So how many ACEs do young people in Ireland have? So this is just to give you an example from a small study that we did, where we looked at young people who had already committed a criminal offence or who were at risk of committing a criminal offence. And what we found was, if you look at where the arrow is there on the screen, 63% of them had 4 or more adverse childhood experiences already as children. And in the general population, it's about 12.5%. So you can already see that young people who are at risk already have experienced a significant amount of trauma. The sad part about this is that education is a huge protective factor for these young people. The longer we can keep young people in education, the better it is for their outcomes. But most of these young people will not stay in education because they really struggle to be there. In terms of adult homelessness, and this is specifically about education, but I wanted to share something that really struck me. We looked at adverse childhood experiences in adults experiencing homelessness in Cork City a couple of years ago. And it won't be a big surprise that lots of them had experienced adverse childhood experiences. But one of the things that really stood out to me was the age at which they had left education. Most of the adults experiencing homelessness in Cork had already left education by the time they were 14 years of age. 26% of them were in care as children. So this is a group of people who missed out on a huge protective factor, and that protective factor being education. And within education, that's your opportunity to meet with your one good adult. I examined a PhD a couple of years ago, And the PhD was written by a man who had spent a significant amount of time in custody. And he did his PhD on adults who had desisted from crime. And what was really interesting when I was reading his PhD was one thing that we know about crime is that people tend to age out. So they reach a point in their lives where they get too old for crime and they start to age out. And when he was interviewing his participants, and that moment when they decided that I can't live this lifestyle anymore, what happened in that moment? So many of them were in custody when they had that moment. So they're sitting in their cell and they're thinking, I can't live like this anymore. It's too stressful. And they make a choice then that they want to desist from crime. But what was really interesting in all of those interviews is every single one of them, one of the reasons why they were able to make that decision is they remembered one adult from their childhood and their adolescence that said something about them. So going back to, I think it was Kim brought up Brafenbremer's statement about every adult or every child needs at least one adult who is crazy about them. So for these adults, when they were children, there was one good adult who said something really positive about them. Now, at the time, they might not have believed that about themselves because they were experiencing such adversity. But what happened was they heard it. And when they needed to dip into it as adults, they could. And I understand that when you're working in education and you're working with young people, particularly when you're working with young people who may be chaotic or have lots of things going on, that sometimes you can get tired and you can get frustrated. And Kim spoke about that, about the trauma contagion. One of the hard parts about working with young people is you don't always reap the rewards of the seeds that you sow. So when you say something really positive to a young person today who's struggling, and their behavior might seem challenging or aggressive or problematic, and you say something positive to them today, you might never see the rewards of that. That might be that child who in 10 years' time goes back to college and says, I remember this thing that somebody said to me 10 years ago. And that's why it's important. I'm not going to get into this because and Kim spoke about this in her presentation about the impact of toxic stress on learning. But I do think it's something that it's really important that we understand that in education, that there are lots of children who come into our classroom in the morning and they really want to learn. But the part of the brain that is there for learning is not working as well as it could be because that's what stress does. Some people might look at those children and say that their behavior is dysfunctional or that their behavior is maladaptive. Actually, their behavior is very functional and it's very adaptive. Their brain is doing exactly what it should be doing in a moment of crisis and stress. So if we want to be trauma informed, we need to rethink the language that we use around children. We need to strengthen their protective factors by making sure there is that one good adult. We need to advocate for them so that they have better socioeconomic advantages. And one of the ways they will get that in the future is by keeping them in education for longer. And by having really good schools that can hold children and you can recognize that when children are being difficult or problematic or challenging, that they're actually communicating with us. The principles of trauma-informed practice have already been mentioned. And Elizabeth and David spoke about this, and this is something I really want to reiterate as well. There are lots of organizations and institutions and individuals, and you meet them and they say, I'm trauma-informed. Well, I'm here to tell you, you are not. Being trauma-informed is a very long journey. Some organizations might never become fully trauma-informed. And what you need to do is you need to aim to be first trauma-aware, then trauma-sensitive, then trauma-responsive. And if you do finally reach a stage where you believe you're trauma-informed, I can guarantee you, if you assess your service again, something will have shifted and changed, and you'll find yourself starting all over again. So how do we respond? So by having an organizational culture that supports students and teachers and understands the role of trauma, by having access to good supervision, particularly for teachers who are, carrying a huge trauma load, as in they're providing a lot of pastoral care for students who are struggling. by having reflective practice. So being able to admit when you did something wrong, what went wrong and how could we have done it better, by being at least trauma aware. If we could all start at being trauma aware, that would be great. And by practicing self-compassion. So thank you. That was a very short or a very quick flick through of everything that I wanted to say. But I'm conscious that we have a very exciting panel waiting for me in 1 minute.
You have indeed, Sharon. Thank you so much for that. And you have actually pulled together quite a number of the things that we're hoping that we're going to be talking about over the next half hour or so.